Hello, and welcome to the first session of the 2020 Virtual Bleeding Disorders Conference. My name is Bill Roby, and I'm a Government Relations Specialist with the National Hemophilia Foundation. Thank you for attending Evaluating Choices in a Changing Insurance Market. Before I introduce our speaker, I'd like to share with you some information about this virtual session. This session was recorded on July 6th. However, the speaker, Marla Feinstein, and I will be available to respond to comments and questions live through the chat function on your screen. This presentation is approximately 35 minutes long. Marla will remain online to answer questions through the chat box for the full 45 minutes allotted for this session. If you would like to ask Marla a question that does not need an immediate answer, or that we don't get to before the time runs out, please enter your question in the Ask the Speaker box. Those questions will be collected and submitted to Marla for a response after the session is over. All presentations are recorded and will be available to watch online after the conference is over. It's now my pleasure to introduce my colleague, Marla Feinstein.
Thank you, Bill. Thank you, Bill. Welcome to what I call the best session in our virtual world. I may be a bit biased, but I consider evaluating plan options a necessary evil, if you will. So our goal is to make this process a little less painful. That's the best we can do. First things first, the ACA remains the law of the land. This is often forgotten for two main reasons. One, because it's been 10 years since its passage, and two, administrative and legal challenges and other activities have sought to dismantle the ACA in various forms. In doing this, the message has somewhat been slightly convoluted. What does that mean? So if you think about 1332 waivers are just a policy that allows states to waive certain regulations in order to improve their market or to test new and innovative ways to install guardrails to protect patients. However, there has also been a simultaneous relaxing of said guardrails, giving states more flexibility in designing waivers. By relaxing these guardrails, we're sort of losing some of the patient protections that were included in the ACA. They have also established something called health reimbursement accounts. These are employer-sponsored accounts that in essence help cover healthcare costs. These are distinctly different than health savings accounts. And finally, they've made some changes which challenge the exchange program integrities. For some states, this means enhancing or improving their exchange, while in other states it means relaxing or having less control over what goes on in those states. And the other hot topics for administrative activity are a frequent news item, right? You hear a lot about drug pricing and how to control costs. Sometimes this drug pricing includes Medicare, other times it doesn't, and other times it extends to private insurance, and sometimes it's also both. And another big media news item is for Medicaid work requirements and waivers as they relate to Medicaid, which is any modification in your state's eligibility rules, right? So Medicaid has done a number of things. There's Medicaid managed care, and then, back to what is the congressional oversight on some of these state waivers. And again, Medicare for All has been in the news a lot, and as it relates to universal health care coverage. But what we're going to do now is sort of, now that you have that context, that the ACA is still the law of the land, and we're going to remind people of this every day, we're going to walk through some of these changes and how they could impact your decision in choosing a plan that's right for you and your family. Next slide, please. A big concern of our community has been the expansion of non-ACA compliant plans, or so-called junk plans, as some people call them. This is tied to what I mentioned just before, is this relaxing of the guardrails that protect patient access to affordable healthcare coverage. Plans that are ACA compliant include these 10 essential health benefit categories. that the ACA had started. These categories include drug coverage, inpatient care, outpatient care, preventative care, maternity, among others. What's important to note is that these non-compliant plans or junk plans do not always contain those categories. The non-compliant plans come in 3 flavors. You have your short-term limited duration plans, or STLDI. You also have something called association plans, and you also have ministry plans. Association plans are when a bunch of small, super small, or individual employers can band together and form what is loosely termed an association plan. Ministry plans are more of a buy-in option. It's pooled resources and then claims are paid through this pool. The U.S. House of Representatives recently released a report highlighting some of the practices of these non-compliant plans. This is important because it highlights that these plans operate in a huge regulatory gap, if you will, meaning that there's little federal or state oversight. Moreover, they have limited benefits and financial protections, meaning they may not cover everything, right? They can exclude coverage for what is a basic service, i.e. 95% of plans do not in fact have prescription drug coverage. They can also discriminate on individuals with pre-existing conditions because there's nothing that regulates them and says they can't. They can also rescind coverage, meaning taking away your coverage, and they can leave them be left with uninsured and worse, large bills. I mean, they're both fairly worse. And they're susceptible more to deceptive and fraudulent activities. So what does this mean? It means that brokers receive incentives to provide and sell these short-term limited duration plans. And the marketing materials are intentionally misleading and or incomplete. And you don't always disclose the relevant plan information and exclusions. So you could be sold something which you find on at first glance to be comprehensive when in reality it's not. So where does this put us? Next slide, please. So don't be fooled is the short answer, right? And that's a lot easier said than done. One of the key things for people to look for in plans is namely the cost, because you're looking at your premiums, your deductibles, and copays. So if you're looking at plans and you see just one plan that is significantly less expensive, that should ring a whole lot of bells in your head, right? That should mean like something is not right here. But what does it mean in this context? It means that when you're looking and sorting by price and you see one glaring error, you need to think about why that plan is cheaper. Why is that one plan different than all the others? So instead of looking at the price, you should maybe consider what are the benefits included in this plan? What about the network? How are my benefits covered? But this is all to say it all takes time. Okay? And when you're looking at a plan, you need to set aside some time in order to evaluate these choices. States have a range of approaches when it comes to oversight in these short-term limited durations plans, with some, as you can see, prohibiting them entirely. You have others that are imposing tighter rules, and then some that are even limiting them or restricting them. However, even with the lighter rules or the restrictions, they remain in the non-compliant group, and that is what's the most important about this. The one saving grace, if you will, is for these plans is that they're not allowed to be sold on the marketplace, but are allowed to be sold by agents by a list of approved agents through the marketplace that are capable of selling these plans. So what happens if you unknowingly somehow signed up for one of these plans, which has happened, and because in theory they shouldn't take people with pre-existing conditions, but anyway, it could be that there's some way that you're qualified for these plans, and then you're suddenly dropped. What does that mean? You would think it would qualify you for a special enrollment period, but in fact it doesn't. You are no longer qualified for a special enrollment period under the I lost insurance part. So how do you consider a plan? Next slide. That is all about finding balance, finding what you can pay for and what you need. And these two things don't always work out, okay? And it is a very complicated calculus. So what you need is access to your hemophilia treatment center, drug coverage, your primary care doc. But what happens if you have a family and you need to consider all their doctors as well? Often we always worry about just specifically the bleeding disorder, right? And then find out that the plan doesn't include other specialists, like a pulmonologist for someone who has COPD or something, or another family member. The tools that insurance companies use are called networks, right? Which are these bands of groups. So if you just think about it as a dartboard, so you have this network. You have to consider what is inside the network as well as what is outside the network. In general, the smaller the network, the cheaper the cost because they're controlling who's inside that network. And that means, by extension, then that there are fewer doctors that are included in that network. The larger the network, the more it costs. It may even have some out-of-network coverage. You never know. It may not have rules that determine whether or not you can see a specialist. You need to see your primary care physician first. Then you have to think about the type of plan that you're considering. Is it a PPO or a preferred provider organization? Or is it an EPO, an exclusive provider organization? Or is it a point of service plan, or any other flavor and variety you want to throw in there? The different types of plans also play a role in the price of the plan. With the more permissive, i.e. not requiring you to see a primary care physician before you go to your specialist, may in fact cost more. Each plan has very, very specific rules and terms in order to control these costs. These rules can seem burdensome, in fact, and limiting. But if you consider them before you enroll, you can plan accordingly, which is not always the perfect answer, but at least you know that what rules are in place and how much time you need to allot to this. Even with all the planning and your time and energy, there are pitfalls. I spend a lot of time working with the community members, helping them understand what their options are. Sometimes it's only when issues arise, okay? And what does that mean? Next slide, please. Over the years, I've heard a lot, all of these issues that are currently up on the screen, okay? So let's take a moment and consider what each of those mean. So if you're hearing they asked about my current health status, what we know is that insurers cannot charge more based on your medical history or because you're a woman. There are three things that insurers can vary premiums by. One is your age, two is the number of people you're considering in your family, and three, whether or not you smoke. So if you're hearing they asked about health status, that should be a red flag. Brokers are a bit of a tricky situation, as I alluded to earlier. Ideally, you want an unbiased source of information. Unbiased is built into marketplace plans, and there are free assisters and navigators in those plans that will help you at no additional charge. Recall when I mentioned that short-term limited duration selling practices are a bit sketchy? This is a big concern when it comes to the marketplace plans, because sometimes there'll be a redirect or something that looks a whole lot like healthcare.gov, but it turns out it's .com, okay? So the website, you have to make sure healthcare.gov and that you've spelled everything correctly and that you're not being redirected into something which is a little bit questionable at best. And then when you think about something my pharmacy recommends, well, it's also a lot like saying, my best friend also uses this plan and they love it, okay? You need to consider the source. You may trust the source, but your employer-based insurance is going to be different than your best friend's employer-based insurance, right? You may live in different places. You may live in different cities. You may live in an urban or rural setting, whatever it is. Therefore, the plan networks are going to be different, okay? So there are countless examples of situations that people get like, well, it was just word of mouth, like this is supposed to be a better plan. Each plan is different and each is an individualized situation. So I want you to consider all of those things. Then there's the separate, I got a separate drug plan. All ACA compliant plans come with prescription drug coverage. It's one of the 10 essential health benefits. So if you need to buy a separate drug plan, you're probably not buying an ACA compliant plan. And it was cheaper. We talked a little bit about it, and we'll get into a bit more about what it means to be cheaper on the next slide. Okay, so you need to be aware of are some of the known issues with plans, right? Some of the things we know about. Marketplace navigators, as I mentioned, still exist, but finding one may be a little bit challenging because the funding has been seriously restricted. Everyone agrees that affordability remains an issue, okay? And we as NHF are aware of that, state and local governments are aware of that, and federal government is aware of that. But what we want you to understand, what is affordable to you may not be affordable to me. And this is sort of a moving target because each year your costs will change. Plans go up, cost of living goes up. You may be moved, right? And you may have heard or read that the marketplace premiums are skyrocketing, which is only partly true. Because if you look at the chart, what you'll see here is that on average, premiums are going down. On average, across the U.S., premiums are going down. And that's important to understand because that's all the 50 states and it's all the different areas for these silver benchmark plans, okay? But there's a huge amount of variability based on where you live. A plan in New York may be more affordable than in Minnesota or vice versa. And plans also vary based on metal tier, meaning when the marketplaces use this metal tier categories for plans, so you have gold and silver and bronze and whatever, so they may all vary based on which tier you find yourself in. So that's all to say that while the national average may be going or maybe decreasing, your individual premiums may not. Okay? But this is largely due to those people, most people who are buying qualifying coverage through the marketplace are qualifying for lower cost alternatives or subsidies or advanced premium tax credits. So that's sort of why you're seeing this disparity between what your out-of-pocket cost as an individual and a family on a plan. Next slide, please. Hopefully I've convinced you by this point that you should plan on spending a little bit of time looking at what is right for you and your family. But even if your job, your family, your finances haven't changed, consider that plans change. Okay? They're allowed to and do. So even if you had an Aetna plan this year and are planning on sticking with your Aetna plan through your employer this year, the next year, what you need to know is sometimes the specifics found in that plan may in fact be different, okay? And you cannot just assume because you had it last year through your employer, it's kind of the same, because kind of is the optimal word there, right? And that includes, who's in your network. So you need to, at a bare minimum, review this annually. You need to look over your options thoroughly because your plan choices may have changed. In addition, your benefit design may have changed. And that's important for factor because that means that clotting factor could be covered either under the pharmacy or medical benefit. It could be in both, actually. So it could be that it's changing. You also need to know that. And if you are changing insurers, you cannot assume because it was easier when I had insurance company one and now it's more difficult, so the process should be the same in insurance company number two. No, right? You don't you just because the things have similar mechanisms on the surface doesn't mean that they may be exactly the same in how they institute a policy. You may have also been recently impacted by COVID, and as a result, your income has changed, okay? So before, you wouldn't have qualified for some of these subsidies or advanced premium tax credits on the marketplace, but maybe now you do. Alternatively, your state could have expanded Medicaid, and now you may qualify for Medicaid. So income matters, and it changes. But always review, ideally before open enrollment period, but as soon as the plans are released for the coming year, and it takes time to review those plans. Next. We recently updated our NHF Personal Health Insurance Toolkit. That can be found at hemophilia.org under Advocacy Tools and Resources. This is a very comprehensive, trust me, 86-page document that includes everything you really need to consider for when you're thinking about choosing your own plan. That is available for our community. It highlights very, very specific things for the bleeding disorder community, but it also works on any other plan that you need. So I encourage you to explore the toolkit, which includes a glossary and acronyms and all these other really helpful fact sheets about appeals and grievances. And now we'll get into some of that. Next slide. The first thing you need to consider is open enrollment. Okay? The most important thing, and I cannot stress this enough, is you need to pay attention to specific deadlines in your state. Okay? If you're enrolling in a marketplace plan, or you need to pay attention to specific deadlines your employer has, because deadlines vary by state. They also vary by type, meaning a marketplace plan is going to have a different timeline than your employer plan, okay? Why does it matter? Because without a specific life event or a special enrollment period that qualifies you for based on a specific life event, be it birth, marriage, you cannot change your plan in the middle of the year. Plans are signed contracts, and now you are bound to that contract until the next open enrollment period. And I think people often get inundated with keeping track of dates and times. What I find is easiest is just putting it in your phone, putting it in your calendar, and getting repeated reminders about when that period is and when things are released. So what type of things should you ask? Next slide. Okay, so what we've done, we've got you covered here. We have outlined some of the general and bleeding disorder specific questions that you really should consider. And by no means is this intended to be a full list of considerations, but it is absolutely where you should start. We've talked a lot about cost. And in general, you need to consider for yourself and your family, what are my monthly and annual, premiums? Can I afford that? What is the total out-of-pocket cost? And by total out-of-pocket cost, I mean everything. I mean co-pays, deductibles, co-insurance. What is the network composition of the plan I'm looking at like, right? What does it allow me to see specialists with a referral, without a referral? Who's is my primary care physician in my network? Is my pharmacy in the network? Does it allow out-of-network coverage? Are there any limitation on services that you or a member of your family use? Is there out-of-state coverage? I know that this is an issue with a lot of plans, right? If you live in one state but you're work in another, you need to make sure that those plans overlap and that your plan that you're considering is in fact has coverage for that service. There's also bleeding disorder specific questions. Factor coverage. Is it under medical or pharmacy? This is always one of the most rate limiting steps, if you will, because it's very difficult to figure out where the factor coverage is, because sometimes it's medical, sometimes it's pharmacy, and sometimes it's both. Do you have your choice of specialty pharmacy provider? Now, this is a bit of a sticky situation, right? NHF's policy has always been more than one specialty pharmacy provider ideally should be included in a plan, okay, which ideally 1 through 4 to be in one either. But a lot of insurance plans now have only one specialty pharmacy provider that is in their network. If they can deliver the factor, and that is great. And do I need a referral to go to the HTC? Because the last thing I want to do is go to my primary care physician just so they could tell me that I need a referral to go to the HTC. Do copay cards count towards my out-of-pocket or deductible? This is a newer issue, and we'll get to that in a second. And am I allowed to use third-party premium assistance? Some plans will not allow you to use third-party premium assistance. What services that I'm using require a PA or a prior authorization? Those are things that, take time and are fulfilled by your physician's offices. What about home nursing services? Is that covered? But this is just the start. Next slide, please. So you may have heard about accumulator adjustment programs, and they're defined as programs which plans will put in place that impact your ability to use copay assistance cards. In general, these, unlike conventional benefit designs, these programs no longer allow the assistance programs that you're using to count towards a patient's out-of-pocket max or deductible. What we know is that plans can use these programs, and if a plan uses them, then the manufacturer's copay card may not count towards your deductible or your out-of-pocket. What we also know is that the language is extremely difficult to find in the plan. And CMS has issued guidance about this, which doesn't specifically allow or not allow plans to use this, so you need to be made aware of this as a possible issue. Next slide. One of the best things, in my opinion, that the ACA did was establish the Summary of Benefits and Coverage, or the SBC. These allow you to easily compare between plans. Don't worry about what all you're seeing on your screen on the slide, but rather there's a wealth of information, and these are 12 to 14-page documents, 15-page documents. But I want to highlight that all the blue that you're seeing, the underlying blue text, are hyperlinks that allow you to find out additional information. Specifically, I want to call out what the arrow is pointing to is a hyperlink to specialty drug coverage. Ideally, if you look through and see that additional information, I would, highly recommend clicking that link and exploring what are the specific policies in place that allow for, what are the rules that the plan has for specialty drugs. It also allows you to see all the other plan information that is available, allowing you to make your own individual assessment. It also allows you to directly compare plans based on the same criteria or make this apples to apples comparison. For example, I can see on this plan that they don't require a referral. And if that's important to you, you need to be able to access that information so you can make an informed decision. You may have noticed I kept saying you a lot, and that's largely because, the next slide, that is largely because only you know your needs and your family's needs, and only you know the answers to some of these questions. And even if we have the answers, it's just there's always going to be some piece of the puzzle which is missing. These are just representative questions that we often hear of things that are mentioned. Oh, I forgot to tell you, I was going to spend 6 months in Florida or something, right? So you need to consider you and your family's personal situation in addition to affordability, right? Are you presenting an accurate representation of your annual costs? What about the family members? Did you honestly forget someone had something and they needed it and you didn't consider it? These are just some of the questions, right? Because another thing to consider is if I'm looking at my plan choices and I go, I don't like them. But what about access to other insurance choices? My spouse or your partner can say, well, we can go on my plan. That may be something you can consider. There are just numerous opportunities and things that are easy to miss when you're evaluating your needs and what those needs are, in addition to affordability. Next slide, please. So where does this leave you? Well, the answer is only you and your family can make the determination about what you need and what you can afford. All the recommendations are conditional on providing an accurate representation of your full financial and health information. It comes down to you making the final call after you've considered all of your options. And that is what, being a good consumer is all about. Next slide, please. But we also know that no plan is perfect. And we get that mistakes or problems often arise. And that is the most problematic and time-consuming part of this all. So let's say you did all your homework and you chose a plan that you thought had met your needs, but now you've been denied coverage or you are unhappy with the coverage you receive. So you're sort of, what are your options? Well, there's some an appeal and grievance process. Appeals are a request to reconsider a decision that was made to deny coverage or restrict coverage for a service you wish to have received or has been recommended. A grievance is more focused on the quality of the care and what you didn't like about it, whether it was the customer service, whether it was the wait was too long, whatever it is, your plan promised to call you back and they never did. These are all very frustrating things, but there is a process in place. There's also a fact sheet in the handbook, in the toolkit about this that talks about what are your options. Next slide. Okay, plans will often send mail, like a lot of it. Some of it will be snail mail or some of it will be email that inadvertently ends up in your junk folder. They send these determination decisions to you, and that is why it is important that you open all of your mail. Check your spam mail folder. I mean, we have this problem. We know that sometimes filters in email programs default to spam. So they have to notify you when a claim is denied. They have to notify you of their decision. But plans also have very, very, very specific processes in place to address the issues following their rules, which includes getting the claim denied and then filing an appeal. You cannot move directly to step 2 without stopping at step 1, okay? You have the right to request an internal appeal. Then you have the right to request an external appeal only if the internal appeal is denied. What is that predicated on? The internal appeal actually being denied. You have consumer assistance programs. So these are not financial assistance programs, but these are state-run consumer assistance programs through the Department of Insurance. You can, if you go to the toolkit, you'll see this as well, where you can file an appeal and request a review if your state, in fact, has that program. And finally, these appeals can be made in different languages. You may be entitled to receive an appeal notification in your native language upon request. But it's important to remember that you can't go to step 2 before step 1. Next slide, please. And that is meanings follows their rules, and as convoluted as they may seem, and they are convoluted and they are time consuming. It is this, right? You can request, and it is following their rules and their timelines. In this case, for an internal appeal, you request that 6 months from the date of denial. What does that mean? On 6 months and 1 day, you cannot request that appeal. There's nothing in place that I can make happen or anyone can make happen because those are their rules. Moreover, the plan must give you their decision within a certain time frame. Within 72 hours, if it's for an urgent care type of situation or emergency care, is 30 days for non-urgent care that you haven't received, right? So if you know in 6 months you need a CT scan, that would fall under here. And it's 60 days for services that you've already received. All levels of these processes must happen within the time frame as stated. However, as with anything, there are some exceptions, and group plans some group plans may require more than one level of an internal appeal, which was news to me when I first learned it, before an external appeal can be submitted. Next slide, please. Well, where do you start? Well, the first place is the physician, whether it's for a service or a prescription that they've written or whatever, a test that you need. You have to start somewhere, right? And that's in general contacting the prescriber who wrote the prescription for either the service or the drug. And all of that is in the denial, right? But in order to know that, you need to have the denial in your hands. And sometimes it cannot be a word of mouth. The denial needs to come to you. You need to read it. It has a specific case number and what have you. So therefore, again, you can't go directly to number 2 without doing step 1. You need to ask your physician to contact the insurer, because insurers have something called a peer-to-peer review that allows them to talk physician to physician. It won't be HTC to HTC, but it's still, they will talk amongst themselves and will detail the specific reason that any of this was denied. And they may even request an easy resolve process. If the peer-to-peer claim is still denied, then you have the right to appeal that decision, okay? But it's important to remember, again, each plan has its own process, and specifics about the information that you need can be found in your plan. And I don't mean like the shiny one that entitles you to free gym services. I mean like the 150-page one that will outline these processes. Alternatively, you can call the number on the back of the card. Next slide, please. Most important, make your words count, whether you're explaining it to me on the phone or customer service on the phone or in writing. You need to be clear and concise and make your words count. When requesting an internal appeal or an exception, write a clear, concise, and simplified letter giving the reasoning, okay? The clinical information, that you personally know regarding your health and your medication history. And also request your medical records, because sometimes those help. Oftentimes they will require those. If you're requesting medication, you need to include information on the other drugs you may have tried, right, that may have failed you. So those are important steps you need to, important things you need to include and consider, because you need to explain to the insurance company why these drugs can cause harm. And you also need to include any adverse events or side effects that you may have had to similar types of medications and why they were ineffective. And finally, if you want to include a letter of medical necessity from your physician, the provider's office is more than happy to help you doing this, and they are there to help you. But whatever means you choose, it is important when you're explaining to be as clear and concise as possible. Next slide, please. Which then brings us to, what do we know? What do we know so far? We know now more than in previous years. You really, really, really need to be a good consumer, and you really need to do your own homework, okay? There's a lot of things out there, that we talked about earlier in the presentation, about short-term limited duration plans, about, marketplace plans, about employer plans. You need to do your homework, and that takes time, and you need to be aware, and you need to shop really carefully, because there are pitfalls, there are deceptive practices. And please do not buy a plan just because it costs less. I know affordability is an issue. But please just consider why that one plan is costing less. And if we could stop and just one decision. And ask as many questions as you want. That is your right as a consumer to ask as many questions. Whether it's, does it have the providers I need? Are there limits? Can I get this drug? Do I need to go here? Whatever it is, ask the questions before enrolling. And I've said it before, and I will say it again. Only you know your needs. Only you know where those restrictions are. Like whether or not you are incapable of traveling to this position before that position, whatever it is. But please, please, please ask for help. NHF is here to help you. I do it all the time. I help people. I will not make a decision for you, but I will help you make the best decision for you, right? I will help you evaluate your options. Your HTCs will also help you. Every year we have a social work insurance and reimbursement conference, which takes the providers at the HTCs and tell them about what are the trends, what are the issues facing reimbursement challenges. But don't wait till the last minute to shop. Do not wait to that, because when you call at 4 and you say, I have to make a decision by midnight, that is a very difficult situation for everybody, really, because you cannot make a full decision and a full evaluation of all your options in that short a time frame. So if you want help and you want to base solid recommendations and avoid some of the common pitfalls, you have to do your homework, and that involves not waiting till the last step. And finally, be prepared. Be prepared for higher premiums and plan accordingly, right? Whether it's a matter of putting more money in your HSA than you had in previous years, whether it's a matter of refinancing something, just know, be prepared for higher premiums and plan, because you don't want to be stuck going, oh, I had no idea this was going to be this expensive, right? Just remember in the back of your head that costs rise every year. Therefore, your cost of living rises every year. Therefore, you have to pay accordingly. Similarly, your situation, your personal, family, and financial situation may change every year. So that is also important. So be prepared and plan accordingly. And next slide. As I mentioned before, we are here. We are here, and your social workers, your ACC is here, so feel free to contact me in a post-COVID work way. So the best way is probably email, and then we could set up a time to chat if that works better for you. Quite often it's about talking through some of these decisions as you see them and how best to address them for you and your family. While we can't make a decision for you, we can make one that best fits your situation. So thank you again, and I am available for questions. As a reminder, please take a few minutes to fill out your session evaluation forms, because these are really meaningful. We do take a lot of time and go through the evaluations and looking for new ideas, and we're always willing to include and implement new ideas and share your comments with us.